So I think we will start. I assume we will have more participants join us as we move on, but I'm Margaret Brodkin. I am the Director of Funding the Next Generation, which is sponsoring this exciting webinar. And it's called How Crisis Creates Change, and we're going to get introduced to a very interesting, exciting initiative that is happening now in Fresno. But Funding the Next Generation, I founded it about 5 years ago to help people around the state create dedicated funding streams for children and youth, as I had had the opportunity to do in San Francisco. And so we work around the state with coalitions and individuals, but mostly coalitions, to help them organize to get local funding for kids. We sponsor all kinds of learning opportunities, conferences. We speak at local meetings, at conferences. We provide coaching, troubleshooting, and have created a lot of different tools. And our website is fundingthenextgeneration.org, where you will find a lot of tools about how to create dedicated funding for kids. So when COVID came along, we were obviously very concerned and concerned about what was happening to our children, and sort of wondering, well, what are people going to do now? How do we keep the movement going? What is possible during this time of COVID? And there was some federal money, and we encouraged people to apply for federal dollars to see what could happen in their communities for kids. And I have to say, the most inspiring that I have found, I can't say I'm aware of everything that's happening in the world. I'm aware of a lot of what's happening in our state, and the most inspiring initiative and action is being done in Fresno. So I thought it would be a wonderful opportunity to share that with people. And I'm going to turn this meeting over to Linda Gleason. I first want to introduce her to you. Before I do that, I want to say, if you have questions, put them in the chat, and note that we are recording this, and that means that we will send you the recording. So if there are parts of it you want to hear again, you are welcome to do that or share with other people. So Linda is a moving force in Fresno County. She had a background in program management and communications and public relations, and 10 years ago, she started to focus in a very targeted way, using all her skills and her credibility in the community to improve the welfare and well-being of children in the county and in the city. So she became a founding member and the managing director of the children's movement in Fresno. I started learning about that almost as soon as it started. It was a very exciting effort. People around the state were looking at it. They're doing this in Fresno. How exciting is that? And then in 2015, she founded something called the Cradle to Career Partnership, which is a collective impact approach to social change. And she has been the executive director of that, which brings together partners from all sectors, from the nonprofit world, from philanthropy, from government, and they coordinate and facilitate networks among leaders, practitioners, and parents. They focus on improving the health and education outcomes for all children, and they build trusting relationships among people all over the county who are working toward this end. They collect data, they connect people to the data, they've published reports that have really moved the needle in Fresno, and they generate ideas and inspire collective action. They work to align and leverage resources towards shared goals. So you can see that this work has helped create the groundwork for the Health Equity Project. And Linda is going to share us how the trust and collaboration and the spirit and common vision that they have developed for vulnerable children has created a new way of providing public health. So Linda, the floor is yours. And we're all excited to hear you have a panel of 6 people. It will be very interesting to everyone.
Thank you, Margaret. Good morning, everyone. I appreciate the introduction, Margaret, and the chance to share our work with this network throughout the state of California. We're happy to be here and share the story of how Fresno is responding to COVID-19 by building a public health infrastructure outside the walls of government, using some of our city and county CARES Act dollars. So this project involves multiple CBOs and agency partners. So many of them, many that are on the call today, have been part of the work behind the children's movement, Fresno Cradle to Career Partnership that you mentioned in your introduction. And I'm joined today by some of the people who were integral in getting the project proposals that were directly related to the COVID-19 project drafted, negotiated, and now operationalized. So each of our contributors today are going to share some of the programmatic pieces with you, and also some lessons learned about the processes, which I can tell you was not for the faint of heart. I'm going to tell you a little bit more about each of them as we go through the program, but as an overview of the Fresno team joining me here today, it includes Dr. Tanya Pacheco-Werner, the Assistant Co-Director of the Central Valley Health Policy Institute at Fresno State, and Joe Prado, the Division Manager of Public Health at the Fresno County Department of Public Health. Genoveva Eslas, Program Director at Cultiva la Salud. Shantae Davies Balch, the President and CEO of B.L.A.C.K. And Dr. Stuti Kandawal, the Assistant Clinical Professor at the UCSF Fresno Medical Campus. And before I hand it over to our team, I'd like to provide just a little bit of background. Fresno C2C is just one of several community-based partnerships that operate in Fresno County. And between what we call our network of networks, we've assembled a valuable civic infrastructure that extends from top institutional leadership to the grassroots organizations who work closest with our children and our families. One of the most important things the network of networks did, just as shelter in place was happening in March, was to pull together, organize, and facilitate a weekly call between our county Department of Public Health and community-based organizations throughout the county. There were quickly over 500 people registered for the call, which has now been going every week for 7 months. And each week, the Department of Public Health shares up-to-date information about all things COVID. In addition to pandemic information, our partners share about current response work and what else is needed. Through this call, we were able to mobilize field teams to work on specific areas like food and housing, education, and the team that would focus on undocumented specific issues would become the Immigrant and Refugee Coalition. A Spanish call that they've launched happens every week as well. So simultaneously, our Immigrant and Refugee Coalition and our African American Coalition conceived the idea that community health workers, also known as promotoras, could be deployed as trusted messengers in their communities to try and reduce the spread of the virus. At about the same time, and because of our connections to Funding the Next Generation and Margaret, and our national network, Strive Together, Cradle to Career was introduced to the Children's Funding Project, and Kylie Wheeler and Elizabeth Gaines from CFP did a webinar for our local policy stakeholders about how CARES Act funding could be used and was being used in different parts of the country. The light bulbs went on, And a long story short, our proposals for community health workers and a comprehensive COVID-19 community-led public health strategy was created and presented to city and county leaders. To date, $10 million in CARES Act funding is being invested to meet immediate needs that are also connected to our long-term goals. So with that, I'd like to introduce Dr. Tanya Pacheco-Warner from the Central Valley Health Policy Institute at Fresno State, who is one of Fresno's amazing next generation of leaders whose passion and commitment to seeing this project through was invaluable. Thank you, Tanya.
Thank you so much, Linda, and really appreciate the space and the opportunity to talk with you all about what our coalition is trying to do together, and really thinking about COVID-19 from an equity perspective, and trying to bring in those resources to those communities where we know that not only prevention but testing and supports needs to happen. Um, so I really thank you for this opportunity to just talk and really, as Linda mentioned, your space and your work really opened up the doors for us in terms of what we already knew we wanted to do something since um, early April, and meeting with you really opened the doors to being able to expand what we were going to be able to do in the population we were going to be able to reach. As we know that, I don't have to go over this too much, but um, when we were meeting as organization leads in starting in April, we knew that we needed to target interventions, and my colleague Shantae will talk a little bit about what was happening in the African American community, um, and a coalition of us coming together, um, serving immigrants and refugees, was also identifying that this disease was going to hit this community hardest because of all of the barriers that we already know, and so many of you that work in the sectors that you do already knew that these people were the most vulnerable. So we were committed to trying to find a way, an approach that would ensure that not only the resources would go to those most affected, but that they would go in a way that the communities would both be most receptive to the help, and that the help would actually be helpful, right? Because not all help is always helpful if we don't know how to approach it correctly, and that's really what really launched us in doing this type of work differently. If we go to the next slide, we we were getting intelligence on the ground. I can remember bringing in one of our partners that works with the Punjabi community, because I collaborated on a news story um, that was about a family, a woman of Punjabi speaking, who went into the hospital, did not understand that she was being discharged, but still positive, and went home to infect her whole family. And I really knew that we were getting this type of intelligence on the ground, and soon enough the data was going to be there to show us this disparate impact of these communities. And so in Fresno County, like much of the country, as we saw last week in the CDC data release, that um, Hispanic Latinos are among the most impacted people for a variety of reasons that I won't go too much into today, but really stems down to why so many of essential workers will be vulnerable, right? They can't stay home for their work. They didn't have the resources, the access to care before the pandemic. They didn't have them now, and they were also going to be faced with additional barriers in their home to be able to safely quarantine. and the barriers to physical barriers to isolating, but also the financial barriers to skipping work for so long. And so the data was, shows us, like so many other things, that when people are most vulnerable, then they end up getting sicker and end up dying more. And that's what we're seeing in Fresno County, and now has been confirmed throughout the country as well. So what to do about this, really? When we started to talk about this, we knew so many of us in the community had worked with community health workers before, and we knew that the Promotora community health worker model is not only an, an approach that is so embedded in equity towards working with families, but also equitable because we knew that there are these people that whose work is now precarious in terms of, will they be able to help their families. And we also know that these are the people with the most expertise of what you really need in a public health situation, which is on the ground intelligence, because we know that data is delayed, right? When you're talking about something that's happening live right now, right? We can't wait for the data dump every month or so. That we really need on the ground intelligence to make decisions live. And we know that community health workers are those types of people who would not only be beneficial to curbing the pandemic, but also in order to work with community. It's also an equitable approach to employ people from the neighborhood to help their own neighborhood also, right? And so that is really what's embedded into how we decided to approach working with families in our community that are most impacted. And so you'll hear me use the word promotora and community health worker interchangeably, just because we also want to be attuned to the cultural resonances that promotora has in the Latino community, but doesn't necessarily have the same meaning in the African American community, for example. But really, this is a model, to and from, from and to the community. That's how we wanted to approach the pandemic response, and really be able to be a help to our public health department partners to get the information to people about how to correctly wear a mask, how to correctly quarantine, who needs to quarantine, who needs to isolate. And also, we embarked on this audacious goal to also say, you know what, we know people are going to be so scared of answering the phone to do contact tracing. But if it's someone that can speak their language, if it's someone that is from their same neighborhood, perhaps we will have a better luck with contact tracing. And so we embarked on that as well. And we also know, as so many of you, and I've seen now at a national conversation level, we knew in April that people needed help quarantining, that while there's a lot of employment assistance available, not everybody knows, or the support won't come in time for them to be able to make that rent payment, right? And so we knew that quarantine supports were needed as well. And so those are the ways in which we formatted what we were going to do, how we were going to address it. And while this actually started as something we thought we were going to pilot, thanks to the coordination with Cradle to Career and your organization, we were able to actually expand this into something that is so beautiful. Now that I'll let the folks know, but we've now trained 100 people to be doing this community health worker work. They're out in the community, they're helping with testing events, they're doing contact tracing, and we're about to launch them being able to provide direct quarantine support. So this is really a dream that started a couple of months ago, that with everybody working together, it is really coming to fruition now. And I want to just touch a little bit on the last the next slide here, to just say that that we want this response. When we envision this response, we wanted, when we say wrap around, we really meant let's wrap ourselves around the community in everything that we need to do, and do it from an equitable way. So when we say the equity project, we really mean it in every sense of the word. People are getting paid not only minimum wage, but a living wage. Nobody is doing this work for free, because we wanted people, we knew that for months, our community-based organizations, our executive directors had two jobs, their day job, and then supporting, what felt ethical to them the rest of the time. And we really felt like, let's do this from an equity perspective and really resource this approach, so that people are not only being helped, the community isn't only being helped, but those that are doing the work, the community health workers, the CBOs that are small and running on shoestring budgets most often, are also being resourced to do this work. And for me, that's what's exciting, to just kind of even imagine and then have that reality happen, and have it really be set as a standard moving forward, right? So I will let my colleague from public health talk a little bit more about really what it took on the inner guts of public health to make it happen. Linda and Joe, take it away.
Tanya, thank you so much. And yes, we are going to kick it to Joe. And I'll just say this. In the context of this being an amazing partnership and negotiation between a coalition of community-based organizations and our government, our local government, Joe was nothing short of incredibly instrumental in making this become a reality. So Joe, thank you so much for your commitment to this work and for being a part of today.
Great. Good morning, everybody. I'm just really honored to be here with my fellow panelists and really share our story with you today. And this wasn't easy work by no means. This was very difficult discussions, very hard discussions we had to have. But it was just amazing. As we started responding to COVID here in Fresno County, initially we were really focusing on establishing our incident command structure. There were some key areas of both clinical and communication we need established right out of the get-go. And as we started working on those issues and we started developing the response, we knew we lacked community engagement. We know that as a public health department because we see it on an everyday business that we need to improve community engagement, and we needed some help from our CBOs. But when you're drinking out of a fire hose, you don't have the planning, the foresight, like I need to go talk to some people. Where do we even start? And that was a difficult thing of really, where do we start? And what really came to us from the COVID Equity Project was just an exceptional proposal. When we got this proposal, it was definitely equity was at its core. But what we liked about it the most is there was good administrative structure to this proposal. We had the African American Coalition, the Immigrant Refugee Coalition with lead agencies, and they would be supporting local CBOs in management of this response. We saw the Central Valley Health Policy Institute, an arm of Fresno State, really building up the backbone infrastructure as it relates to data and data management and tracking. Very great proposal when we got this. It had a budget attached to it, go figure, right? We needed to know some dollar amounts attached to this. And what was very key to us once we received this proposal is that there is an emergency declaration. Under normal circumstances, we can't start working through a complete scope of work without going to some sort of bidding process. So that emergency declaration was key, and us being able to sit down and start reworking the scope of work, adding some pieces to it, and just really be able to meet our community needs. But at the same time, how are we going to manage this? And so in the proposals, as we went through the contract negotiations, you see a lot of key pieces in there, confidentiality at the foremost. This is now, we're giving protected health information to a CBO during a time of response. So confidentiality was at the forefront. Accountability was absolutely the piece of it. And then measurement. How do we measure success? How do we measure whether or not this is actually a good investment of these COVID dollars? And we were able to build that into the contract with lots of discussion with our CBO partners and really seeing what other issues came up. And other issues did come up. One of our lead agencies didn't have experience in management of federal dollars at that time. And so they had lots of experience with state dollars, but no federal. So we found another partner in our Fresno EOC agency to be the fiscal agent to the Building Healthy Communities lead agency of the Immigrant Refugee Coalition. We had to really navigate through the contract discussions and how to establish this, but not only for COVID equity response. Right now, what we're doing is we're giving up some key public health infrastructure that we do on our own. Contract tracing, for instance. That's something we just never have given up. That is something public health does consistently. And so being able to work with the CBOs and giving them a key public health arm really is what public health is all about. We need to start thinking about public health not only within our government walls, but outside. And this COVID Equity Project really builds a foundation for that. So we start with COVID equity today, but what can we move towards in the future? And so as you can see, the investment we made on just the COVID Equity Project that we're managing here, our Access and Functional Needs project that is up and running. And understand that all these coalitions, over 21 CBOs, they're managing contact tracing, they're managing quarantine supports, all within the same databases. And they have developed these databases with our guidance and our oversight as well. So that's another key win of building a foundation of sharing data as we move forward. And so, as we talk about, I loved Dr. Pacheco's nice, where we wrap around all these services. And as anybody who's used to implementing anything of this nature, it's muddy, right? It's messy. So how does this actually look? So as we go to the next slide, I want to show you a little bit of one of our current events. And so we partnered just a couple weeks ago. This area is about 30 minutes south of downtown Fresno in a rural area. It's Lanier Community Service District. It's an unincorporated area. And so we brought in our clinical partners, Family Healthcare Network. We brought in our other social justice group, Leadership Council, and we partnered them with our CBO folks. And we did an event that included COVID testing, that included a food distribution, and included education and outreach. So as we move on to the next slide, you'll see how beautiful and muddy this can be, right? So you can see at the very bottom, you got the food distribution line, those cars there for the food. And then you see on the back there, the mobile health unit there that is doing COVID testing. So this is actually, they functioned this very well. Logistically, they had everything really dialed in. They were towards the street. We had cars lined up towards the back end of that street as they were coming through. So this alignment is very key as we brought in our partners to really connect them up to the right clinical partners and existing organizations that are doing amazing work. Next slide. So, there's another key piece in here is City of Fresno received their own COVID dollars. And so they have their own scope of work. They have their own funding source that we don't have any say-so in. So how does this even align with City of Fresno's Equity Project? And this is what I like about the COVID Equity Project the most. It actually helped the city and the county to align our resources. When they brought over the scope of work, as we refined it, they pretty much took that same scope of work and took it to the City of Fresno. And so there is one scope of work for this entire project here amongst city and county dollars. Administratively, we created one invoice. We created one billing guidance document. We've created one quarantine support guidance as well. And so this is where the CBO, the COVID Equity Project bridged us together and brought us together. And so as our business management folks and our auditors look at this, it's great. This is how you avoid double dipping when you're all aligned and you're actually under the same framework there. And so as City of Fresno has an amazing partner, you're going to hear from them a little bit later in UCSF. They've been great clinical partner as they're part of our county discussions. and really making sure we're on the same testing modality. We understand that the reporting is all in line. So there's been a great glue that the COVID Equity Project has brought to both city and county. So those are some of the comments I wanted to share with the group today, and I'll just kick it back over to Linda. Thank you.
Joe, thanks. And again, I was mentioning in the chat about if there's questions about why this was not for the faint of heart, and the contract negotiations is certainly an example of one area where it would be great to work toward improving that process. And you've been so instrumental, as I mentioned. So I think Mike, am I having you step in here, Director of Go Public Schools, a key and integral partner in the Immigration Coalition, Refugee and Immigration Coalition. Thank you for your leadership, Mike, and in navigating this large group of CBOs represented in this coalition and the success that you're realizing in this process.
Well, thank you. This is Mike Espinoza, and thank you for that introduction, Linda. I think if there's one place that I'd like to just kind of double down on Linda's comments and some of Joe's, as well as Dr. Pacheco's comments, is that, you know, in order to really join in a, you know, mutually beneficial partnership, I mean, it really does take some intentionality from each of the interests and organizations to kind of set aside their needs at some point and look towards the broader needs. And I think that's really what kept us coming together over and over in having to face this initial challenge. So as you can see on this slide, you know, the families that we talk about with the group of us that started to come together around immigrant and refugee issues, you know, in the Central Valley, the breadbasket of you know, the United States, if not the world, and a lot of the families that pick those that work in those fields and support the agricultural industry that's the heartbeat of this area are the folks that we had in mind, front and center, every single time we came together. To give you a picture of who was in that coalition, if you go to the next slide. It was a small group of us. First, you know, our leaders at Fresno BHC, as well as Fresno CBHPI at Fresno State, the Jakara Movement, Fresno Center, all of the different groups that touch the lives of the constituents that they work with, primarily from the immigrant refugee community. We knew right off the bat that our communities were coming to our organizations as trusted, you know, agencies and trusted individuals to say, hey, this pandemic has hit. We're scared. We don't know who to turn to. Some of them did not feel completely connected to the local institutions and government agencies. So they came to us first. And so we came together and said, gosh, what do we do? And we knew that the things that bound us were really wrapped up in that we were trusted community-based organizations. We were working day in and day out directly with these families. We wanted to establish that we boasted, you know, some long-standing established relationships with Asian, Middle Eastern, and Latino communities. Our different groups represent at least 12 languages that we do outreach to in linguistic and cultural communities. And we've got deep experience in navigating this particular model of outreach, where community leaders are trained and coached to become the ambassadors of public information and outreach and resources. And many of the folks in this coalition that you see on the screen have worked together across projects and initiatives for over 10+ years. So the foundation was set by establishing some mutual, you know, some baselines that, one, we need to pitch in, do something, but the scale of the project or the scale of the problem was where we knew this was beyond us as organizations. Normally as individual CBOs, we could pitch this to a funder and say, hey, could you kick in a couple of $100,000 so that we can launch a X, Y, or Z program with X, Y, or Z outcomes for the first time, we were faced with, you know, a ubiquitous project, you know, a ubiquitous situation or a ubiquitous crisis that was touching literally everybody's lives. So if we go to the next slide, that's why we started thinking about scaling this up. And starting to imagine beyond what many of our CBOs had really done in the past, and thinking, gosh, you know, we can't just think in the terms of our, you know, of the scopes of work that we had been traditionally working around. You know, we can't just think in terms of our kind of our fiefdoms of funders and pockets of support. We had to think globally. We had to think holistically about this community. So we started to dream up, in collaboration with all the different partners that you've seen showcased here, but, you know, and with, you know, Joe from the county, just started talking about, what if we were able to field 100+ community health workers, which actually we've done, right? And what if we were able to provide culturally adapted training, which day in, day out, our partners at CDHPI and led by Dr. Pacheco are doing, providing culturally adapted training. What if we were able to coordinate activities and collaborations across a wide berth of organizations and institutions? You know, this was really what we started to envision several months back, and you know, I'm just, you know, so pleased to say that we made it a reality, because so many different forces stepped in to kind of join hand in glove to make this possible. I mean, part of all of this is understanding that while we all have our needs and wants individually, we need to sometimes that as community, we need to come together and in order to face the crisis in front of us. So finally, some of the pieces that we are responsible for as a coalition are really grounded in outreach and engagement and education, food distribution and delivery, financial assistance, PPE distribution, and also just getting the word out among our networks and meeting people where they are, which is what we do best. Going to people at their, you know, workplaces, at the places that they shop, at the places that they worship, reaching over to them out their phone, you know, training volunteers to encourage their neighbors to get tested and you know, get the information they need to navigate this crisis together. So I think if there's one thing that we could kind of point to as what made this possible, was just this willingness to, you know, envision something big and then to lean on each other to get it done, was kind of what made this possible overall. I think before we hand off to our partners in the African American Coalition, Shantae, who you'll hear from in just a moment, and I talk all the time. We work together very closely in our education organization. But we talked about how the Immigrant and Refugee Coalition and the African American Coalition were working, you know, in silos to begin with, but we knew that African American and the Immigrant and Refugee Coalition had to come together. And we formed, we ended up falling into marriage, and you know, and marriage is tough. For those of you who are married, know that it's not always easy, but it is necessary, and it makes each other better. So with that, I'll close out the comments for the Immigrant and Refugee Coalition.
Good morning, Shantae. Thanks for being with us, and thank you so much, Mike.
Good morning, everyone. Such just great backstories and comments from my colleagues. And yes, Mike and I have gotten into the habit of saying that we decided to get married, and it's been a tough marriage, but it's been a really valuable marriage that I really believe is going to have generational impact, actually, in Fresno County. And so Mike just spent some time highlighting some of the, you know, work that we're doing as CBOs in the community. And, you know, we are working together as a coalition. And I want to say, for me personally, that's probably the most beautiful part about this partnership is, you know, there are immigrant refugee testing events that are being planned. Then there's events being planned with the AA coalition. And then you get to the event and it's staffed by both African-American and immigrant refugee coalition members. And so as an example of that, this past Saturday, we had an event at a local community center, and we had representation to support our African-American residents. We had community health workers to support our Hispanic, Latino, Spanish-speaking residents. We had folks to support our South Asian residents. And so it was really just this, this really beautiful coming together of different populations and groups, understanding that even though we all have different needs, we also have similar needs. And some of those similar needs, for example, is just being able to receive a service and feel comfortable, for example, right? To receive a service and feel like you're getting it from a trusted partner, and to receive a service in a way that's respectful to you. And so that's really what's been happening with these events. And so on the African-American, within the African-American Coalition, we very strategically partnered with these key organizations that you see listed here. And we spent some time also before we came together as a coalition, just talking about on the ground, what are the specific needs of the community. And so you saw like Saints Rest, we know in the African-American community, for example, that places of worship are places of trust, right? And we also know that those congregate settings, that's also where we know that, you know, community spread happens, right? There's lots of hugging and kissing. And so we really wanted to partner with our congregational leadership. We also knew and had data around what was happening with small Black businesses in Fresno County. And so we wanted to be able to provide extra supports in that sector as well, in terms of around employee rights and helping employers make sure that they're compliant and ready to support their employees in a safe working environment. Lastly, we wanted to look at the social and environmental needs of our community. And so that's why we partnered with some of the other organizations to make sure that we really had expertise in terms of case management, social work services, and so on and so forth. And so with that being said, really our overall goal and intention, going back to what Joe said, was to look at our public health infrastructure and to look at this as an opportunity to find ways to build out capacity within our community for our community going forward. And so one example of that on the AA side, our community health workers went through a certified 42-hour training that's certified through the Fresno State, it's Central California Paraprofessional Training Institute in partnership with Fresno State. So that's an example of equipping community health workers through a certificated program that's valuable. It's the same training actually that social work students receive at Fresno State. And so now, right, they have this certificate from Fresno State saying, right, that we have these needed skills that we can contribute. And so we're focused not only on serving the community right now, but also we're looking at how we support the work going forward. And so the last thing too, I'll say is just, you know, for folks listening to this webinar or for folks that will listen to it later on, I know it's being recorded. From a CBO perspective, I really feel like this is something that is scalable, but it's only scalable if you have the right institutional leadership that is willing to listen to the actual operational process that CBOs function under, because it's so much different from how institutional leadership, such as Joe, for example, who really has been central to making sure that the CBOs have what they need to function, and really serving as that liaison to ensure that we can bring the two sectors together to work. And so that's been really key for the success of what we're doing in Fresno, is having our institutional leaders understand like, what does equity really mean if we're trying to support the community? What does it mean when we don't just want feedback, but we hear you, and then we're going to make some changes based on what the community said they needed. And so I'll just end by saying, I really feel like having that shared understanding of what equity means amongst our Immigrant Refugee Coalition, the African American Coalition, and then our institutional partners, that has been key to the success of what we're doing. Thank you.
Shantae, thank you so much. And for all that's reflected in your understanding of the process and what it takes to be successful, and your willingness to really show up as a servant leader, wanting to do what's best for all of our children and families in Fresno. So we just appreciate your expertise as well so much. And I'm looking forward, now you get a chance to meet with Dr. Stuti Kandawal, the assistant clinical professor at the UCSF Fresno Medical Campus. And my goodness, I have enjoyed getting to meet you, Dr. Kandawal, and appreciate so much your perspective on this work and what you and UCSF Fresno are bringing to this coalition.
Thank you, Linda. It's an honor to be here. It's an honor to have served as the Assistant Medical Director for the UCSF Fresno Mobile Heal COVID Equity Project. So just a little bit of background, UCSF Fresno is a regional campus of the UCSF School of Medicine, which is the main UCSF in San Francisco that we all know of. And our mission, our focus is on improving health through basically 4 areas: medical education, patient care, research, and last but not least, community service and partnership. So speaking to the last piece, which is most pertinent to this webinar, we already had a mobile heal type setup for the past couple of years, but on a very small scale. We had this ambulance van that would go out with our medical students, residents, and volunteer physicians out into the community, and we would provide primary care services and whatever the community needed, blood pressure checks, diabetes checks, HIV testing, etc. So when our dean was approached to partner with the CBO Coalition and the COVID Equity Project, it was just a perfect marriage on how we could take our services beyond the usual walls of the clinic and hospital. And you see a nice photo of that in our medical campus on this slide, and to really think beyond that and to meet the patients where they were, and to really actually bring this partnership with this long overdue partnership with our amazingly empowered community-based organizations to fruition. So if we go to the next slide. The CEP mission statement, right, is to provide equal access to COVID-19 testing and other health screenings to underserved areas in Fresno, specifically communities of color. And so what we did, I'll actually let this video kind of show you what this work has looked on the ground. I'm not sure if we could make the video bigger. Yes, we're not able to hear it.
Dr. Condoval, maybe just go to the YouTube video link.
Do I have the ability to share my screen?
You should, the little green button down there at the bottom.
Okay, let me open the video, just a minute.
Yeah, share screen, and then just make sure that you check enable audio, share audio down at the bottom right.
Okay, got it.
Whoever's sharing has to make sure that that audio button is checked. Maybe go back to share screen, and then it'll be when the screen pops up, there's going to be a button on the lower right-hand corner.
Lower right-hand corner.
So stop share, share again, and then the lower right-hand corner, instead of just checking share screen, there's going to be some audio choices down. It should be down at the bottom.
Share computer sound, is that?
Yes.
Okay, all right, let's try this.
Ministries campus. This is a way we partner with
Can
a
people hear the
community-based
video? I
organization.
actually can't hear it myself.
We can hear it.
Hello.
Oh, great.
Good afternoon. This is our static site, which is at the Fresno Interdenominational Refugee Ministries campus. This is a way we partnered with a community-based organization firm. This is a Friday afternoon. As you can see, our parking lot is almost full. We had to close the gates. We do no appointments. It's walk-ups. We don't close down for lunch. So we're really trying to eliminate as many barriers as we can for the community. The patients actually drive up and they are instructed to park. When they park, they are met with our partnering community health workers who register them with a very basic, quick 30-second registration form. And they hand over the information to our medical assistants. The medical assistants have a swabbing station. And the label is delivered outside to our swabber. The swabber puts it on a tube. They go outside back to the car, and the patient actually self-swabs. The NA just watches them do it. The swab is put it in the testing tube, and then it gets processed inside. So this is the inside of our community-based COVID testing center. So that is sort of our assembly line type approach, where labels get printed, lab requisitions get generated, samples gets processed, and then packaging gets done for FedEx. The back table over there is where our community health workers contact patients for contact tracing. Our testing site is very busy. We have done as many as 300 tests a day, and we're absolutely targeting the lowest quartile of the health equity metric. So we don't say no to anybody who comes here, but absolutely our target population are underprivileged, communities of color, underrepresented minorities.
Can everyone hear me back?
Yes.
Okay, great. So as you can see, it's housed in the community at a community-based organization's campus, and we've really integrated our community health workers who are actually at the forefront. And this setup is, we try to take the setup wherever we go. We are actually, as we speak, testing at the Poverello House, at First 5 Fresno, at EOC on Tuesdays. We actually did the entire Big Fresno Fair. And the list keeps growing. So I was also asked to share some lessons learned, and I think in addition to what everyone has said, I'll just say that one of the main things is, and I think I can probably speak for everyone, is Given the scale of this project and the mission of what we're trying to do, one of the statements that I feel like we all have to remind ourselves is, basically we all have to drop our egos and do what's best for the community. To keep all institutional differences aside, to be really respectful and be humble about sharing expertise and hearing different perspectives. And I think that has been very invaluable. The second lesson I would say is the COVID pandemic really highlighted the need for data sharing. And it's been really great to see the county and the community-based organizations now being able to use the same system. And on our end at UCSF Fresno, something that traditionally has not been done between medical institutions and community-based organizations and county is a linear transfer of data bidirectionally. And this is something that we have not given up on. And I'm very optimistic that UCSF Fresno might be able to have some form of communication, HIPAA compliant transfer of data bidirectionally across the three groups. And then finally, the last lesson learned is, again, the COVID-19 pandemic was a very unique challenge in which everything had to be rushed. Everything was very time sensitive. We had to serve our communities immediately. However, having said that, you are still working within pre-existing bureaucracy, pre-existing institutional norms, cultures, setups. You still have to go through all the different all the different red tape and wait for lawyers to agree, et cetera, et cetera. So I will be very honest, we've all had our painful moments, and we've all been like, oh my goodness, if you could just listen to the people on the ground, if you could just let us do what we need to do, rather than people sitting afar and arguing over something which is important, but again, is slowing us down. So I think something to think about would be in emergencies like these is to figure out how we can hand over the decision-making process to actually the people on the ground. I will stop there and I will hand it back to Linda. Thank you.
So that's certainly, this is Margaret speaking. Linda and I have been, we're out of time, but that is such a great way to end this turn this over to people on the ground. I am aware that there's a lot of questions that people have, and a lot of things people want to say. This has been such an exciting chat, back and forth and back and forth. So as I said in the chat, Linda and I will collaborate about a follow-up email that will include all the information, a link to the recording, other lessons that Linda wants to share, and the question of whether you want to hear more. Because I am gathering from the questions that a lot of people want to hear more. But I loved this because it really was, it took many legs to the stool to get this to happen, not the least of which is UCSF, all the CBOs, the health department, and having a backbone organization that built a foundation of people trusting each other, having a plan in place, and being able to bring that plan to the Department of Public Health. So there are so many lessons learned, and this is so exciting, and this is how you can get in touch with me. We are going to have a national institute of anybody on who is interested in it, about how this movement of getting funding and using funding and creative use of funding around the country is happening all over. So you can email me if you're interested in that. And Linda, do you want to have a final goodbye or comment?
Well, I just want to thank everybody for participating, and really to our local leaders here and all that you represent. It's really, truly remarkable, and we appreciate your hearts and your passion for this work very much.
the people were fabulous. The whole thing was just fabulous. And thank you all so much. And I think we will close now as it's 2 minutes after 12.
Thank you, Margaret. Have a great day, everyone.
Thank you.